Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you're all fine and doing well for your exams. Daily we are seeing 5 important MCQ for the exam of AIIMS, RRB and JIPMER. So today also we are going to see the 5 important MCQs. So we'll start today's session with a small quote. Our greatest weakness lies in giving up. The most certain way to succeed is always to try just one more time. நம்மளோட கிரேட்டஸ்டான வீக்னஸ் என்ன? சீக்கிரமா ஐயோ நம்மளால முடியல வேணாம்னு சொல்லி விட்டுறது. ஸோ அதை எப்படி நம்ம ஓவர் கம் பண்ணி சக்சஸ் பண்ணோம்னா, அந்த விடுற டைமில் ஏன் ஒன் மோர் டைம் நம்ம ட்ரை பண்ணக்கூடாது அப்படின்னு திங்க் பண்ணுற அந்த மென்டாலிட்டி தான் சக்ஸஸ்க்கான வழி. ஓகேவா? ஸோ வில் ஸ்டார்ட் டுடே செஷன். Today we are going to see about a question related to the COVID-19. Very, very important MCQs because in most of the exams, they have asked 1 or 2 questions only. So this time we are expecting more questions from the COVID-19. Okay, let's start the first question. Name a clinical trial in which blood is transfused from recovered COVID-19 patient to a coronavirus patient who is in critical condition. The question is what they are asking about. ஒரு COVID-19 பேஷண்ட் இருக்காங்க. ஸோ அந்த பேஷண்ட்டுக்கு எந்த பிளட்டு யாரோட பிளட் எடுத்து கொடுத்தா ஸோ தட் வில் பி ஹெல்ப்ஃபுல். ஸோ விச் பிளட் டு பி டிரான்ஸ்ஃபியூஸ் டு த COVID-19 patient so who are in the critical conditions. So the correct option, the options they are given: plasma therapy, solidarity, and remdesivir, hydroxychloroquine. So what is the correct option? So the correct option is plasma therapy. You all know what is plasma therapy. They're removing the blood from the person. So they will remove the plasma. That plasma can be transferred to the COVID-19 patient. For example, I am a previously COVID-19 patient. I am recovered from the COVID-19 patient. Okay, I'm recovered from the COVID-19 disease. So what they will do, they remove the blood from me. So that plasma can be transfused to the person acutely ill at present, or his condition is very worsening. So that time we can give my blood to that COVID-19 patient. So there is the chance of recovering or due to the immunity, because I am immune against COVID-19 after the exposure. So my blood having some immune complexes in my blood. So that is why my blood is transfused to the COVID-19 patient at present. Okay. What is solidarity? Solidarity is nothing but the WHO and various research center have undergone the research study. They used 3 medications like artesunate, infliximab, and one more is there, imatinib. So 3 medication they have used for the research study to treat a COVID-19 patient. That is comes under solidarity. Remdesivir, it is an antiviral drug that is used in the treatment of COVID-19. Okay, there is no transfusion happening here. This is an antiviral. Hydroxychloroquine, this also in initial stage of COVID-19, they have used this anti-malarial drug to treat the COVID-19. Clear? So the correct option according to this question is plasma therapy. From previously exposed to COVID-19 person who recovered from the COVID-19, that blood is transferred to the at present who is having the COVID-19 infection and critically ill. Clear? Yes. So next question. Which of the following diseases are related to the coronavirus? MERS, SARS, both A and B, only B. So what type of coronavirus it is? COVID-19 is a what type of? It is both the A and B. What is MERS? Middle East Respiratory Syndrome, and SARS is Severe Acute Respiratory Syndrome. So this coronavirus comes under both the category. Okay, it comes under both the category. MERS otherwise called MERS-CoV virus. SARS is otherwise called SARS-CoV virus. Okay, these are one family only. These all comes under one virus family only. But this coronavirus contain both the MERS as well as SARS signs and symptoms. Okay, and their genetical condition, genetical variability also same like MERS and SARS. Okay, so the correct option is both A and B. Next question. On which day is the public curfew, that is Janta curfew, imposed due to coronavirus? Especially this question is related to India, so we can expect this question. Okay, what is Janta curfew? When it is imposed due to coronavirus, it is 22 March 2020 in India. It announced by our Prime Minister, Mr. Narendra Modi. Okay, it is a Sunday. They have announced that morning 7 a.m. to night 9 p.m. we should not go out until it is an emergency. Okay, that is called a Janta curfew. It is imposed due to coronavirus on 22 March 2020. Clear? Yes. Next question. Which state became the first state to lock down due to coronavirus? Very, very important MCQ. So the correct option is Rajasthan. Rajasthan has become the first state to implement this lockdown due to the coronavirus. Okay. They have shut down all the educational and most of the small clinics and everything they have closed. Only the government setting hospitals only running to treat the COVID. Other remaining schools, colleges, public transport, okay, everything they have shut down. So this is the first state given the example to how to cut down the COVID virus in our India. Okay, that is important. After that, only each state has started their lockdown period. Okay, so the first is Rajasthan. Next, what is the name given by scientists to coronavirus before Wuhan? So when everybody knows that the first virus was detected in the Wuhan city, China. So before that, they also discovered this coronavirus. They given the name. So what is the name of that coronavirus before it become COVID-19? So the correct option is SARS-CoV-2. It is not SARS-CoV-3, not SARS-CoV-1, not China virus. Okay, illiterate people will say, or doesn't know the correct scientific name, they will call it a China virus, but it is not the correct option. SARS-CoV-2 is an given name for the coronavirus before Wuhan get affected. Okay, right? Yes. So it comes under SARS. Coronavirus comes under SARS group. Everyone knows it. Yes. Okay, that's all about today's class. I hope you understand today's class. Thank you so much and all the best.